I'm very proud to have Tatiana here as a speaker, and I think you get more and very profound information about the combination dexpolymer and hyaluronic acid.
Thank you. Good afternoon, dear colleagues. First of all, I'd like to thank the organizing committee for that opportunity to present our data on this meeting. My name is T.Teterina, as you know. I am a postgraduate in the Scientific Center of Obstetrics, Gynecology and Perinatology, and Professor Inna Polikhina is my supervisor. She is the head of Gynecological Rehabilitation Department and one-day clinic, in which includes the urogynecological part. My presentation is devoted to the Russian experience of administration the dextranomere hyaluronic acid, the Urodex, in treatment women with stress urinary incontinence. All of you know that stress urinary incontinence is the most actual problem in urogynecology nowadays and in the past days. And as Dr. Mirkin said, he told you about the world's epidemiology, and I will tell you about Russia. What the situation in Russia? In Russia, we have 9% stress urinary incontinent ladies, 24-35 years, and more than 36% among women older than 55 years, and also 25-35% among women with prolapse. Annually, we have more than 135,000 operations for stress urinary incontinence. Of course, the prevalence and the more of them is sling ureteropexy, TVT, and more than 200,000 surgical operations for prolapse. But the problem is that only 75% patients are satisfied. And nowadays we have the new actual paradigm in urogynecology, the functional gynecology. It means that you need not only to provide the surgery, but you have to promise your patient that it will be no complications and she will be continent, especially immediately after the operation. According to the Royal College of Obstetricians and Gynecologists data, the frequency of using bulking agents is 48%. But we are using the bulking agents nowadays, but we don't know where it was started. And I will tell you about the evolution of using the bulking agents. First, Mr. Gersuni, is a professor from Wien, at the end of the 19th century, described the injections of paraffinium. Then, in 1938, Mr. Merles described the administration of moral sodium for treatment patients with stress urinary incontinence. And then, with great speed, they evaluate, and now we become to the modern bulking agents. Nowadays, all bulking agents divided in two groups, organic and non-organic. Organic, as you can see, is alloimplantants, xenoimplantants, and tissue engineering. And non-organic, and Urodex is devoted to this group, is the synthetic dextranomere hyaluronic acid, polyacrylamide, and in Russia they are using nowadays also collagen, silicone, zirconia balls, and calcium hydroxyapatite. The gold standard for using bulking agents nowadays it is collagen. It means that while providing all clinical trends for effectiveness of bulking agents, we should provide and compare the results of it with the collagen. What's the main reasons for the stress urinary incontinence? First of all, Of course, it's the urethral hypermobility, and the second, it's the intrinsic sphincter insufficiency. How work the bulking agents? It is considered that they make the mechanical compression in periurethral area. They stimulate the own collagen synthesis, and it's the main their pathogenesis. They increase the force of contraction and urethral sphincter elasticity. That's why they increase the length of the sarcomere. There was a study that used the urethral pressure reflectometry, and they described that even higher the cross-sectional area of urethra after the bulking agent injected in the periurethral area, then the higher the pressure in urethra, and the patient become continent. Now you can see the different types of bulking agent and the different types of their introduction. Some of them need the endoscopic assistance. As you know, the polyacrylamide, in Russia it's Balcamide. I will tell a little bit later about it. Actually, we have some requirements for bulking agents. First of all, they must have high biocompatibility. They have to provide prolonged treatment effect, and that effect must be immediately after the operation. They should have the ability to stimulate producing their own collagen. They should be non-allergic and non-inflammatory. They should provide absence of fibrosis, and the size of the substances must be more than 80 microns. And of course, they should be very elastic. What are the indications for bulking agents? Of course, and first of all, it's conferred by urodynamic stress or mixed urinary incontinence with the predominance of stress components. But I should tell you that not all types, all stages of the stress urinary incontinence are the indications for the bulking agent. Nowadays, we are talking about the occasional incontinence and mild stages of the stress urinary incontinence. Also, the indication is when the patient has severe extragenital pathology, and when TVT is contraindicated for this patient, when the patient planning pregnancy, when she refuses of surgery, and when she has relapses after surgical treatment, also after TVT. Contraindication. The absolute contraindications are the acute urinary tract infection, pregnancy and lactation, individual intolerance, and urethral diverticulum. And related bleeding disorders, but the Urodex injections, it's the minimal invasive procedure, so we shouldn't get the massive bleeding. The obstruction of the urinary tract, short urethra, less than 2 centimeters, and severe urethrovaginal atrophy. But you can prevent it if you will administer to the patient the cream or suppositories with the estriol 2 weeks before the operation. The bulking agent Urodex composes of 50 milligrams of dextranomere, the sugar polymer, which is the positively charged particles 120 microns, and the 70 milligrams hyaluronic acid in gel, which plays the transporting function. After the injection, Urodex decomposes into water and carbon dioxide, so it's very safety for patient. How we should use the hypotension system Urodex? First of all, I want to tell about the components. It has one applicator, Lewis applicator, It contains 4 syringes of 1 millimeter of Urodex in each syringe and 2 sterile needles, size 20G. What are we doing? The preparation before the operation. 2 weeks before, you should administer to your patient cream or suppositories with estriol daily. For anesthesia, you could use topical anesthetics. Maybe it will be Instagel or Colagel for 8 minutes. Then you start the operation. First you empty the bladder and you measure the urethral length with a catheter. Then you introduce the Lur's applicator into the urethra to the required length. And then you provide 4 consecutive injections of 1 milliliter of Urodex into the 1/3 of urethral submucosa on 12th, 3rd, 6th and 9 o'clock. First I will show you the video with patient and you will see how you provide it. Now you can see the cytoscopic pictures, the urethral sphincter before and after the injection. And now I want to tell you about our experience, our study. We recruited 285 patients with stress urinary incontinence and mixed urinary incontinence with predominant of stress component. Then then only 33 patients met our criteria and they were included in the study. All patients were divided into 3 groups. The first group, 34 patients, was treated with periurethral injections of Urodex. The patient was only with stress urinary incontinence. The second group, 15 patients with stress urinary incontinence, with mixed urinary incontinence with predominance of stress component. They were treated not only with Urodex but with solifenacin. But we administered the solifenacin for 1 month before the operation. Then 3 days before the operation, they stopped taking solifenacin, and after the injection, they prolonged to take the solifenacin for 1 year. And the third group, 24 patients with stress urinary incontinence, they provide only pelvic floor muscle training. And you can see the particular status, obstetric and gynecological status of the examined patients. And the mean age of patients was 48 years. The duration of illness was more than 7 years. And the obesity was observed more than 72% patients. You should note that 46% patients have birth injuries, third tears, soft tissue tears after the delivery. We assessed the effectiveness of the injections by the functional test, PAD tests, questionnaires for quality of life, and urodynamics, of course. And now you can see that in first and in second group, which were treated with Urodex, you can see that after the 12 months after the injection, it was decreased twice the percent of patients with a positive cough test. Now it is the data with comparison the patient of the first group with the Urodex injections and the third group of patients with only pelvic floor muscle training. And you can see that in first group we observed the decreasing of the symptoms on the stress urinary incontinence in third times, and in third group only about 50%. the PAD test. After the treatment, in first group with the dextranomere hyaluronic acid injections, you see that the weight of the PET was not significantly decreased. But in the third group with peripheral muscle training, the weight of the PET increases twice. According to the urodynamics data, we noted that the maximum urethral closure pressure and urethral closure pressure became to normal after the injection of Urodex. We are talking about the first and second groups of patients which are treated with the Urodex administration. According to avoiding direct data, we didn't observe the significant differences before and after the treatment in all groups of patients. In the third group of patients with peripheral muscle training, we also provided the perineal measure because it is considered that the peripheral muscle tonus should increase after such exercises. As you see, 1 month after the treatment and the intensive exercises doing by patients, we saw the twice increasing of the pelvic floor muscle tonus, and then within 12 months we saw that again the decreasing the pelvic floor muscle tonus. And we think that it is maybe because the patient decrease her motivation for doing these exercises. In first two groups with the Urodex administration, we also provided the three-dimensional ultrasound investigation. And we visualized the balls with Urodex. We don't have his laser point. No?
Yes, you don't have it.
I'm sorry.
No, it has to be there. The laser pointer.
Yeah.
Okay.
You can use this one. Okay.
Thank you. And it was your question about the volume of Urodex after the treatment. As you saw that initially we injected 4 milliliters of Urodex in 4 points in the periurethral area. 1 month after the injection, here are the balls. One month after the injection, the volume of Urodex decreases twice. Then, within 3 months, decreases to this, and 4 times decreases after 1 year. So we can say that after approximately 1.5 years, we can re-inject to the patient the Urodex.
Please repeat, please. We talk about centimeter.
Volume, the volume of injected Urodex. It decomposes to the water and carbon dioxide. And you can see that within a month, the volume of Urodex decreases twice.
От 4
2,5.
на 2,5.
Да. Кужим се.
Значи за 3 месеца е наполовина.
Да.
And have you made measures of the new formation? I mean, after 1 year?
Unfortunately, in our study we didn't make it, but we are planning.
Because I see a graphic picture, so you can measure the new formation actually.
No, it's 1 month after the injection. It's Urodex balls. We want to provide the study nowadays with the morphological and immunohistochemistry investigations. We want to provide the biopsy of the periurethral area.
Please repeat. You repeat treatment after
1 year.
1 year.
1 year.
1 year. Okay.
1 year.
Okay, thank you.
What we should do in the post-operative period? Of course, before the patient's discharge, you should control her ability to self-urination. And in case, if you have poor results or your results failed, you can re-inject the Urodex 4 or 6 weeks later. You can repeat the injection of Urodex 2 months later. In our study, we also assessed the quality of life and the level of depression and anxiety in our patients using the King's questionnaire, Zung's questionnaire, and Hamilton's questionnaire. And you can see that in third group with the pelvic floor muscle tonus, there was no significant differences before and after treatment. Maybe that there was no improvement in this patient after the 1 year she provided the pelvic floor muscle training. And in first group and in second group, after the 1 month after the treatment, we noted the significant improvement in her psycho-emotional status, but it sometimes it increases 1 year later, maybe because she again felt occasional incontinence 1 year later. The Hamilton scale, it's the level of depression in patients with stress urinary incontinence, and also you can see the normal patients was only 4% for 40%, and another 50% of patients feel the mild and moderate medium level of depression. And after treatment, we noted the significant improvement for 20% of with the mild level of depression after the treatment. And as you know, the patients with stress urinary incontinence also feel the significant level of anxiety because they're afraid to be incontinent, especially while intercourse. So we also observed the significant level of anxiety before treatment in 45% of patients. It was the mild level, and approximately 20% of our patients have a medium level of anxiety. And after the treatment, after the Urodex injections, we have 70% patients became to normal, and 20% of patients they feel mild anxiety, and there were no medium level of anxiety in our patients. So we consider that these groups of patients should be consulted by the psychiatrist also in addition to their surgical treatment. Our efforts in Russia, we have patented this method, and our patent named a new method in treatment of stress urinary and mixed urinary incontinence in women, and we approved in 2011 the medical technology, the periurethral injections of bulking agents in treatment of stress urinary incontinence in women, and also the PhD dissertation was defined last year. Also, I'd like to tell you about our master classes, that since 2008 we provided master classes. Nowadays it is more than 50 master classes. We are teaching the doctors all around Russia, urologists, gynecologists, therapeutists. So they come to us from all over the Russia.
The right person and with the...
It's
Yeah, this is-
Professor Apolikina.
There's Apolikina, and the
Yes.
other one, the guy is Dr. Dünebacker from Koblenz, next to our place.
Mhm.
No, the other one on the right side. Yeah, there, this was
Yeah.
Dünebacker.
Yes.
Hmm.
It is our articles and abstracts we present our data on different congresses. What are the advantages of Urodex? Of course, it's the immediate result. I will show you a little bit later the video, and you will see the negative cough test immediately after the injection. It is minimal invasive method, so it is possible to provide in an outpatient with the local anesthesia. Of course, if the patient feels significant anxiety, you could provide her the intravenous anesthesia. It's easy to implementation. It is controlled implementation. It's the Urodex is biostable. There is no migration after the injection. We have less complication. I should tell you that in our study, in this 73 patients, we have no complication, no one complication in this patient. And it is biocompatible and biodegradable. I told you that it decomposes into water and the carbon dioxide. They are safety for the patient, of course. And the patient is possible to have a baby also immediately after the injection. She can plan the pregnancy. In our country, in Russia, we also use the hydrogel polyacrylamide, named Biopolimer. You can see this kit. It needs to be the endoscopic control. The preparation for the surgery is same as there is in your clinic. We provide these operations with intravenous anesthesia in one-day clinic, and we provide 3 injections on 3, 6, and 9 o'clock. And we provide the injections using the 3/10 and 6/10 of the hydrogel into the into the 1/3 part of the periurethral area also. There was a multi-center study in the Great Britain, Denmark, Switzerland, and Germany, and they administer the Biopolimer into 98 patients. And they observed them for 1 year. So they observed the recovery was only in 27% patients, and 35% of patients need the reinjection. Average volume of polyacrylamide for one procedure is approximately 1.5 milliliter. But what are the advantages of Urodex? Of course, it is the possibility of precision injection with the endoscopic control and reduction of required volume of injected drug. But in another study, which included 64 patients with stress urinary incontinence, which are also undergone the sling urethropexy, the follow-up period was from 9 to 24 months. And what did they have? The efficacy of this procedure was only 63%. 10% of them were completely continent, and 53% had only improving. And satisfied was 74% of patients. 44% of patients required the reinjection. What was the possible reasons by the mind of the authors of this article? Because of the small volume of injected drug, less than 2 milliliters. Comparing to the Urodex, we provide 4 milliliters into the periurethral area, and leakage of the drug through the injected holes. because of low viscosity. But I should tell you that the needle, the size of the needle for Balcamid is number 23G. Comparing to Urodex, the needle size is 20G. So it's smaller than for Urodex. What are the possible solutions of this problem? Of course, it's reducing the needle's diameter, increasing of viscosity, and refusing of installing catheter, because the Balcamid needs to be assisted by endoscopic procedure, the ureteroscopy. Possible adverse events. Post-operative. Immediately you can have urgency de novo, as Dr. Milken told you about his case. Dysuria, hematuria, but it's very rare complications, and I want to tell you that we didn't have any complications at all in our patients. The urinary tract infections, acute urinary retention, and painful urination for 2-3 days. And for a long-term follow-up, the adverse events may be the abscess formation, fibrosis, dislocation, necrosis, and migration, but I didn't find those complications in the literature. I didn't find it. I don't know, maybe somebody have some complications in the long-term follow-up. And what are perspectives in application of bulking agent? Of course, the future is for the engineering systems and the using of autologous stem cells as bulking agents. Maybe it will be the progressive method. And after the injection, this block of stem cells may be innerved from urethral smooth muscles. And also we can treat with the stem cells the intrinsic sphincter insufficiency. And according to the Strasser data, the efficacy was above 75%. And also in our center, we want to provide such study using comparing the Urodex effect with the Urodex plus stromal stem cells from the umbilical cord. The methodology, the technique of injections will be the same as the Urodex, and we want to compare, because the Urodex plays the bulking is the bulking agent, the bulking role, and the stem cells maybe they also stimulate the some growth factors to stimulate more severe neocollagenosis. Maybe we want to provide such study, and we approved it in our local ethical committee in Russia. So nowadays it is considered the dextranomere hyaluronic acid, the Urodex, is the most effective and the most minimal invasive method today that we can use for treatment for stress urinary incontinence. And now you can see our working team. Dr. Mirkin maybe was on vacation, only women. Dr. Mirkin is
Taking the picture.
Thank you.
Taking the picture.
Take the picture, yeah.
Professor Apolikhina, head of department. And for finish, I want to tell you that the grace for the body, it is the same as the common sense of the mind. François de la Rochefoucauld. Thank you for your kind attention, and if you have some questions, I will answer.
Celebration named estradiol cream daily 2 weeks.
Daily, 2 weeks before
For
the
what?
For anesthesia.
no, not anesthesia.
For what?
It's for postmenopausal patients with urethrovaginal atrophy, because they have very slim mucosa, and we can damage it when we provide the operation. So we need to prepare the mucosa, the patient's mucosa, 2 weeks applying the estradiol cream.
It's a standard
For
procedure.
postmenopausal women.
Only for postmenopausal.
Yes, only for postmenopausal women.
Mhm. It's standard procedure.
Thank you very much. I have a few questions for you. Number one, do you think the idea of having a blind technique like Urodex compared to the Bulkamid under cystoscopic visualization has any advantage or disadvantage? This is a question. Second question, are you or did you start comparing it to the Bulkamid? Because it seems to be like this is maybe the more biocompatible material compared to silicone, for example. The Bulkamid.
Yes, of course, the bulking agent, especially the Urodex,
Yeah,
is more
so-
biocompatible, and there was many studies for it, and also in our center we provide the study in our laboratory of regenerative medicine and fundamental medicine. We provide this study. It's more biocompatible.
No, but I'm saying that did you try to compare Bulkamid to the Urodex? Because those are two different materials, but they are seems to be like having the
No,
similar seal.
they're not likely. Yes, they have some in common, but they are unlikely because the hydrogel is have less viscosity, and the needle for the injection is bigger than for the Urodex. So we have
But no, you said 23 gauge.
23G.
23 means smaller.
Small.
The 23 is smaller than 20.
Smaller than Urodex.
Yes.
So it's a smaller needle.
No, for Urodex smaller than for Bulkamid.
So the needle of Urodex is smaller.
Yes. And the Urodex injections are not so blind because
No.
can I have a
It is, here, it is 24 Urodex. It is
Answer
20.
the question.
Because-
Urodex
The
is
Bulkamid is different to
No, I understand they are different, but you have to compare them on a study
yeah,
to
okay,
know
okay.
which one
Yeah,
yeah,
works.
you can
Later.
see that nowadays it
this
is a
applicator.
ring, the ring. So it's not so blinded.
Sorry, it's blinded because you don't know where
The
it's
ring
the...
helps you to control the length of the urethra.
No, I understand that, but still, this is blind because you don't see. You just put...
You can see it if you use the vaginal zone.
You see the needle, but the needle goes through the urethra.
Yeah, but you can see how when you inject the material into it. By using the vaginal zone. You see here, this is designed, and you make before the measurement how long is the urethra, and you want to go to the injection in the mid of the urethra. And the other point is having the syringe, mounting the needle, and then you gave, let's say, normally it's on D, right, Tatiana? Normally the length is on D. Yeah. And then you insert with
We measure the patient's
the
length.
opening of the needle.
You can put the video. Yeah.
How
We
do
will
you
put the
make it?
Maybe
video.
first
We
we
will
will
put the
see the
video. The
video.
video.
Me?
Maybe first I will show you the video.
Yeah,
How
it is
we will
very clear
measure
how
the
long
length
it
of
is.
the
measured.
urethra.
And then
Okay?
you go in there, and you are exactly on the position.
Yeah, but that's called blind technique because the other technique is just...
Yeah, but it is exact measurement
It's in
because you
line
measure
with
it
the
first.
shape of shape.
Very
What is it?
Shape of it.
The implantation system Urodex kit includes Foley catheter size 14 or 16, Lewis conductor that helps to determine the necessary depth for injection of bulking agent, 4 syringes containing 1 milliliters of bulking agent Urodex, and 2 needles. Preparing for implantation. It's recommended to apply cream or suppositories with estriol daily approximately 1 week before surgery for preparing the vaginal mucosa. Also, broad-spectrum antibiotics could be used in order to prevent infection. Anesthesia. For anesthesia, you can apply 6 milliliters of topical anesthetics. For example, cotton gel, insular gel for 8 minutes, or topically 4 tenths or 6 tenths milliliters lidocaine. Before sedation, we ask the patients to cough. We are providing the cough test. Then we introduce into urethra topical anesthetics for 8 minutes. First, we are emptying the bladder using Foley catheter, size 14 or 16. Then measure the urethral length. After that, we are comparing this length of the urethra with Luer's conductor for providing the exact volume of bulking agent Urodex. Now we introduce the Luer's conductor into urethra and provide 4 consecutive injections in the periurethral area of the middle third of urethra at 12, 3, 6, and 9 o'clock. You always need to control the length of the urethra comparable to the Luer's conductor.
And in your kit, you saw the limited ring, so it helps you to control the length of the urethra. It's shown that you need to provide the cut of the needle up.
One doctor asked me why isn't 4 needle in a kit? Why only 2?
This question not for me.
Not for me, for Dr. Klaus.
What is the question? I'm sorry.
Why isn't 4 needle in a kit? Why?
I can give you an explanation for that. First time we used 4 needles. And
It's not
each
finished.
needle is different. Each needle is unique. It's not all the same time that you have the opening on this position from the end of the needle, on this part. So 1 and 3
Then
are
we
equal.
remove the
2 and
conductor.
4 are equal. So we decided to have only 2, and then we are
And
all
after
time
the
at one
operation, we
position.
provide a
And
cuff
you
test
put on
again.
4 needles,
Now we are
sometimes in
demonstrating
position
the
6, it's a
negative.
little bit more lateral. And the bulking agent is going there instead of like this. We control this by radiography in our labs, in our clinic with Professor Dülleback, and then we decided to have only 2 needles with the same situation here. You know? If you use, let's say, 4 needles, it can be happen that one of these 4 needles is in a lateral position, and then the material goes like here, and then surrounding.
After the operation, we provide a cuff test again. Now we are demonstrating the negative cuff test. Before the patient go home, you should make sure that she is able to self-urination.
Any more questions?
Side effect like retention. Do you have some cases?
No, we didn't have any complications after this operation. No one complication. I think that it's necessary to prevent this complication if you will talking with your patient and you will prepare her for this operation. It will be no complication. Because it's minimal invasive procedure. You see that it's very easy.
I have to correct, because the question, why did you have, don't have a distribution for Urodex in Germany? We have. This
No, no,
5,
change the
that's what you've done using on dogs.
That's very reassuring.
Yeah,
We like it.
yeah.
Dr. T.Teterina, how much time it takes to perform the procedure?
Approximately 10-15 minutes. It depends on surgical skills.
Dr. Tatiana, do you need 6 or 7 assistants for this treatment, or can you do with your own assistant?
Of course, by your own.
Yeah, okay.
You don't need the
It's
assistance.
easy to do.
It's very easy. You saw.
What you say about new kit and
The ring,
stopper?
limited ring.
Yes, yeah. One urologist